The first thing that the physical therapist can be is for the physical therapist to be the first point of contact. So simply, if within the society, we communicate the message that for neuromusculoskeletal related problems, you go right away to a physical therapist without having seen a medical doctor before, that can then become very real, that we're going to be seeing more and more patients as their first point of contact. Now, then, that patient must not just receive a simple evaluation, but it has to be a comprehensive evaluation to look at all different aspects of that patient's dysfunction, that patient's current problem, and overall health. And nowadays, physical therapists are very well trained, especially through the DPT or transitional DPT programs, very well trained to evaluate all different systems of a patient and even make the appropriate referrals when needed. But these evaluations must also include advanced diagnostic testing. So let's think about this for a moment. If you have a primary care physician, it's a primary care physician, a family physician, so that family physician will be viewed as the primary care first point of contact for the other non-musculoskeletal type of problems that the patient has. So if somebody feels they may have hypertension, they may have high cholesterol, they may feel an internal type of pain, indigestion, or any other type of discomfort that is not obvious neuromusculoskeletal in nature, then that person is going to visit a family physician, a internist, a general practitioner. And that general practitioner will not only perform a physical examination to that patient, but he or she will also perform some related diagnostic tests. For example, they are going to take the patient's blood pressure. They are going to send the patient for blood work so they can look at their cholesterol, their liver enzyme, their CBC, and their sugar levels. So in the physical therapy area, when looking at the physical therapist as a primary care provider, we have to look at what is this advanced testing that the physical therapist can provide to accurately and precisely identify the root cause of the patient's problem in a comprehensive evaluation, and then come up with the proper patient management. The parallel to a internist or family physician or a general practitioner to what a physical therapist will do, in addition to their regular physical therapy, physical examination, that can include advanced diagnostic testing such as musculoskeletal ultrasound, electromyography and nerve conduction testing, evoked potential testing, and vestibular testing such as VNG, video anistomography for vestibular dysfunction, which are tests that the physical therapist can perform and can get paid also by insurances for performing them. The third component of the physical therapist as a primary care professional is a patient-centered care. So the physical therapist develops an individualized, tailored to the uniqueness of that patient management program. Number 4 is longitudinal management, where The physical therapist will adjust treatment strategies based on the patient's progress and any changes in their health status. Of course, collaboration with other healthcare providers and referral to them of patients who need to be referred out. And of course, health promotion and prevention, playing a role in specifically advising patients on how they can prevent future similar problems. In recent years, physical therapists have incorporated in their practices advanced diagnostic tools. Some of these models started from the US military, where I told you that physical therapists are regarded as primary care professionals. And in many instances, they are able to refer and or perform tests that now, for the past several years, a couple of decades now, physical therapists in the public, they are able to perform. And these, as I said, are electromyography, musculoskeletal, ultrasound, evoked potential studies, and video nystagmography. So as primary care providers, the use of these diagnostic tests by the physical therapist allows them to provide a higher level of care to their patients and being able to align with the aim of primary care, which is to optimize health and wellness for the patients.